We start with tree pollen in the spring. We then have grass pollen all summer long, all fall long, and even into the winter time along the coastal areas. And then we are suffering from mold season in the summer and fall with rainstorms that increase the amount of mold spores within the air, and then weeds as well. So we really have a very long pollen season and allergy season in Louisiana. If you're a patient that has severe allergic symptoms at various times of the year or even year-round, the first step is to identify what those triggers are. You may know what that trigger is based upon the symptoms that you suffer when you're exposed to, for example, a family pet, such as a cat, or during the springtime, which is when oak tree pollen or maple or elm pollen is prevalent. If you're unable to make a specific identification of your allergic trigger, getting tested, I think, is the first thing to do so that you can identify what the trigger is and what you might be able to do to decrease your exposure to that trigger and therefore decrease symptoms. The other thing you can do is make some changes around your home to decrease allergy symptoms. Simple cleaning more frequently, using a vacuum with a HEPA filter, which will decrease the amount of dust scattered during the cleaning process, are simple things that you can do at home to decrease allergy symptoms on a daily basis. There are two different types of nasal sprays that we typically use to treat allergy. The first one is simple saline rinses to physically wash the particles out of the nasal passages to decrease symptoms. The second type is intranasal steroid sprays such as fluticasone or mometasone to decrease inflammation and thereby decrease the symptoms of allergy. Those medications need to be used almost daily in order to have the maximum effect. Using once a week really does not improve the symptoms of allergy at all, and unfortunately, that's the way most people use them when they obtain them over the counter. So seeing a physician is important so that you can understand the technique of the nasal spray and learn how important it is to use them on a daily basis to decrease the inflammation. I think one of the most important things to think about in regards to allergy, especially in the pediatric population, is the association between allergies and asthma exacerbations. If we're able to identify allergy triggers in our patients with asthma, treat those symptoms appropriately, we are much more likely to decrease the frequency of asthma exacerbations that require oral corticosteroids, hospitalization, and missed work and school. If we can treat patients with allergy, we can decrease the symptoms of asthma.